Hello, everyone, and welcome to our very last installment of our Brain Awareness Week presentations for 2022. My name is Dr. Courtney Ray, and I'm the president of the Society for Black Neuropsychologists. And I am so happy to be able to welcome you for this presentation. We are going to have a fabulous time. We have all week. If you have not seen the first three presentations, I invite you to go and look at those in the playlist. The first one we had was Dr. Travis Shively Scott talking to us about brain health and physical health. Our second presentation was Dr. Kier Mario, and she talked to us about brain health and emotions. I spoke to you about brain health and spirituality, and tonight you will be treated to Dr. Valencia Montgomery talking to you about research and you. And so we want to welcome you and invite you, if you have not seen the previous presentations, to go ahead and go and watch those, like and share and subscribe so that you won't miss other presentations that we have. We want to be able to do these things to serve our community and raise awareness about cognitive health and how we can serve the wider public. Now, we don't want to hold you long. Just like before, we want to keep it between 35 and 45 minutes. And so we're going to do that same thing tonight. We're going to have Dr. Akeisha Harley, who is a neuropsychologist at San Mateo Medical Center. She is a lifespan neuropsychologist, and she is also a leader in the Society for Black Neuropsychology. She is in charge of continuing education with our society, with SBN. And she is going to be doing the interview. She will let you guys know who our speaker is and introduce her. And then our speaker will present, and then we'll take our questions from the audience. Like I said, pretty short. We did go over a little bit last night, but that was only because we were getting such great questions from the audience. And we don't want you to feel hesitant to ask your questions tonight either. So go ahead, write them. We will make sure to get to them, especially because this is the last night. We want to make sure that we're answering all the questions from our viewing audience. And if you are watching this on the replay, unfortunately, obviously, you won't be able to ask your questions live, but hopefully you'll find that the presentation is informative and it's something that is helpful to you and something you'll want to share with someone else. So without further ado, I'm going to bring up Dr. Harley to come and to introduce our speaker for this evening.
Hi, everyone. Nice to see everyone here. I have the pleasure of introducing Dr. Valencia Montgomery. She is currently a neuropsychologist at Riverview Health Physicians, Neuropsychology in Indiana. And she strives to provide culturally sensitive treatment to individuals impacted by poor access to services. She completed her doctorate in clinical psychology with an emphasis in neuropsychology from Roosevelt University and completed a very competitive internship at VA Ann Arbor Healthcare System. She also completed a 2-year postdoctoral fellowship in neuropsychology at UCLA, Geffen School of Medicine in LA, and the Easton Center for Alzheimer's Disease Research in 2019. Dr. Montgomery is very passionate about helping others understand the course, diagnosis, and treatment of Alzheimer's disease and related disorders. It's a pleasure to have you here, Dr. Montgomery. I'm going to pass it on to you.
Hi, everyone. Thank you so much, Dr. Harley. Let me pull up my little presentation. Is it letting me share? Okay. Hold on. I hope everyone's doing well tonight. Our weather is having problems right before spring as usual. Slideshow from beginning. Okay. think if I share screen. Okay. Aisha, can you guys see my screen or no? Oh, I see. Doesn't want to let me. Share. Okay, sorry about that. I'm just going to make this bigger. Okay. So one of the important things that we talk about as part of brain health, we wouldn't be the same without research. And so this particular presentation is meant to engage you in a conversation around the importance of taking part in research such as Alzheimer's disease research and other research studies that focus on brain health and basically brain disorders. But in order to do that, we have to take a little tour through the history of research in the Black community. And I wanted to give you a historical perspective of this. Most people, when they think about research and things gone wrong in research, they think about the Tuskegee syphilis experiment. And if you don't know what that experiment is, it's really a big part of the reason why there's so much distrust around research in our community. This experiment happened with gentlemen who were told that they were getting a treatment for syphilis so that the researchers could actually watch the disease process and learn from the disease process. So many of them died slow, very slow deaths, thinking that they were getting treated and they weren't. But some other things that maybe people don't know about is the Henrietta Lacks story. She was a poor African-American woman who had cancer. She died from cancer, but doctors and drug companies scientists went on to use cells from her tumor for years without her permission, without her family's permission, and really without their knowledge. You also have the problem with Dr. Sims, who was considered the father of modern gynecology. He developed his technique for repairing vaginal fistulas by experimenting on enslaved women without anesthesia. And so again, although these weren't, when you think about the Tuskegee experiment, those were people that volunteered for the research. But in these cases, this was research that was done without the knowledge of people and in horrible ways, really. And then when you consider the sterilization of women, when you think about eugenics back in these days, it was the women that were sterilized were disproportionately Black. So when you think about this as a whole, you can understand why there might be some hesitance about partaking in research even today. I want us to expand our lens a little bit on our historical perspective, because that is a very narrow and important part of our history. But I also, so many times when I hear people talk about it, it's like we forget that maybe there were others that were also experimented on in a way that was detrimental. So one of those things would be the Nazi experiments that were conducted by Nazi doctors in the camps. It involved thousands of prisoners, and they purposely infected prisoners and exposed them to dangerous conditions during that time. There was also the Willowbrook School for Mentally Retarded Children from 1956 to 1971. Now, in order for kids to get to be a student at the school or to be accepted, they had to agree to this. But they purposely infected them with hepatitis through injection. Then they administered these experimental vaccines. So the questionable ways that vaccines come about and the questions regarding this is understandable why people have those questions. But I wanted us to broadly look at this A lot of times it is the population that's most vulnerable back during that time that were the ones that were victims. But that's why we have a way now of trying to prevent this kind of thing happening. And I think at some point, we have to understand how it affects us as a community, how it affects our ability to get treatment for diseases like Alzheimer's disease. And so I wanted to talk a little bit about that. But first, I want to speak our truth, because our truth is important. And I think people are sometimes afraid to have this conversation. And the truth is that no other ethnicity has been subjected to the number physically, not mentally, because there have been other studies that involve non-African American, non-Black participants that was mentally harming, but physically harming research in the history of this country. And despite this, we know from research that has been done that Black people are willing to participate in research, but on our own terms. And unfortunately, a lot of researchers don't take the time to build relationships in the community, which makes it harder for people to make decisions about whether to participate or not. So I'm hoping we can have that discussion today. The truth is, monetary compensation is not always the best nor the only way to recruit into research, nor should it be the only way we make our decision to participate in research. There is a detrimental effect of non-participation, and I chose two things that most people are familiar with: asthma and Alzheimer's disease. So Black children are 2 times as likely to be hospitalized for asthma, and they're 4 times as likely to die from asthma as white children. About half of African American children with poorly controlled asthma benefited from, a study has shown that they benefited more from high-dose steroids than adding the bronchodilator to treatment. There's a reason for this. The reason is most of the people that were in the study that brought that bronchodilator or brought those asthma treatments to bear, they were non-Black. And so when that happens, the doctors are simply applying what has worked in studies to anyone with the diagnosis. And we now know that that's not the best way to do it. However, we can't change that if we don't have a diverse participation. Also, African Americans are almost 1.5 times more likely than European Americans or whites to carry this APOE4 allele, which is a risk factor for Alzheimer's disease. The problem is there's little known about the neural correlates of cognitive function. So a lot of them carry it, but while they carry that gene, it doesn't necessarily express as Alzheimer's disease in our population. This means that when they're trying to decide on drugs to attack, maybe to address the gene at the gene level, or to really try to catch cognitive impairment at the earliest stage, a lot of times they send out for genetic testing and they're looking for these APOE4 alleles. But that's not necessarily, that doesn't necessarily mean it's going to express in African Americans. In other cultures, in other ethnicities, it does. But in ours, not so much. So there's still a lot of research to be done to better understand the compilation of things that come together that really create a risk factor for our community. And we need to do that by participating in research. So as of 2018, there were over 5 million Americans over the age of 65 living with Alzheimer's disease. Of that 5 million, the prevalence of AD in African American communities is double that of white Americans. And most, as I said, most of the drugs developed are most helpful when given as early as possible in disease onset. One way some medical centers determine this is checking for the presence of APOE4 gene. But if that's not the gene that they need to be looking at for our culture, then there lies the problem of people either being worried that they're going to get Alzheimer's when they're not necessarily going to get Alzheimer's, or doctors providing them with medication that they don't need to be taking if they're not actually going to be diagnosed with the disorder. So a number of things can impact our cognition. uncontrolled high blood pressure, uncontrolled diabetes, uncontrolled high cholesterol, untreated sleep apnea, alcohol misuse, smoking, heart disease, among so many other things. These risk factors put us in a position to, over time, it's a cumulative effect that can cause dementia, especially in our population. We won't get into social determinants of health, but it's a whole package deal. But these are the physical things, illnesses that can contribute to setting us up for having a dementia later in life. Not necessarily Alzheimer's, but something that's very closely related, which is vascular dementia. So there's a number of things to consider if you think about participation. You don't want to go for every study just because it's a well-known facility. We know that some of the worst things, unfortunately, have happened at those facilities because people go because they trust and they're well-known. The better thing is to appreciate the researcher, what kind of research they've done in the past, what is the purpose of their research, meaning how is it going to give back, what is it going to teach us about a disease process, how is it going to help us make our brain healthier in the end, what is it going to do for our community, how is diversity going to be looked at within that research, and those are okay questions to certainly ask before you participate in research. Remember, just because a research facility is well known, it doesn't mean that the research that is being recruited for is great research. Just because you haven't heard of a researcher or a facility, it doesn't mean that the research is going to be bad either. This is why we require IRB approval for research. You should always ask for written information on the research being conducted or what it's being proposed and what you as a participant is being asked to do. Now, they should give you that information, but I always believe in educating people prior to enrolling them and giving them a chance to step back and really go over that with someone trusted, another trusted person, to discuss the pros and cons of participating in the research. You can pick a family member, maybe a family doctor, a doctor that you trust, a knowledgeable friend. And so it's good to take the break instead of just saying, I'm going to sign on, but to really give yourself a chance to think about what it means to you to participate, how much is going to require from you to participate, and make sure that you understand exactly what's being asked for you to do. Always know your rights before signing up and keep the contact information for making complaints where you can easily find it. So often people leave studies or there's attrition, and sometimes it's because negative experiences happen, but it's never reported. And that's how bad researchers continue to do research, really, is because it's up to the participants to go ahead and make that complaint and make it plain why they've decided to not continue the study. And that can only make our research more rigorous. So I didn't want to give a whole lot of me talking to you. I wanted to have questions and have this be more of a discussion. So I would like to open it up I'm going to stop sharing now and see if we can open it up for more discussions. And if you have questions about specific things, certainly I can give you more research or more details.
Well, thank you, Dr. Montgomery, for that presentation. It really highlights why it's important that, we participate in research. So I'm going to open the questions to the audience first. We have someone asking, what is IRB approval?
That's a very good question. Oftentimes we use these buzzwords and we don't think about whether other people know what that means. So every institution requires that human research goes to something called an institutional review board. On this board are members of the community of the institution, as well as members that are not necessarily affiliated. So we try to get people from the community to volunteer their time to sit on this board. And what they do, it's their job, it's federally mandated that they do it this way. They all go through training and they sit in a room and they comb through that research proposal to make sure that it's safe for human subjects. And so the more invasive it is, the more layers of this IRB approval that it has to go through. Thank you for asking that.
You also talked about some of the risk factors for developing cognitive decline in Black populations. Is that the same case in the Hispanic community?
So the Hispanic community is any community. So let me say this. Risk factors are risk factors. You don't just have them. It's not like you're Black and so that makes you more at risk. It is, you have these risk factors. So anyone, no matter what race you are, ethnicity, for sure. If you have things like high blood pressure that's uncontrolled, diabetes that's uncontrolled, hypertension, any of those things, untreated sleep apnea, those things set you up in the long run for the potential of developing something called vascular dementia. And it's so closely aligned in so many ways with Alzheimer's disease that there has been discussion. It's like researchers, they're always back and forth disagreeing, but there's been some discussion as maybe it even is a precursor in some cases to Alzheimer's disease. But it does involve problems with your memory, thinking abilities, your cognitive abilities, and it does decline, but it doesn't decline. Your cognitive abilities don't decline at the same rate as Alzheimer's disease. But they don't have drugs to treat it. It's treated by managing those risk factors. So it's treated differently as well. Thank you for that question.
Thanks for the clarification. One thing I wanted to ask and touch upon is that you had mentioned in your talk that researchers are not always building relationships in Black communities, and that money is not always the best way to compensate for research. As a researcher, what are some ways to build these relationships, and what are better alternatives for compensation?
Well, one of them is going in the community. I mean, we believe that everything we need in our community, people come in to take things out, but they don't bring things back in. So when I do research in communities, I'm there. I am coming out giving talks. If people want me to come give a talk, I'm not trying to charge people money. I am going out in the community, letting people know that I'm available to give talks, to educate people on different dementias, my specialty. And so the same as a researcher, if I'm going to go in, I'm going to bring something in with me. And it's not just going to be, I'm going to wave some money at you, because we know that money can be a strong influencer. And so the IRB is there to make sure that the amount that people are offering isn't more than someone could say no to. You know what I mean? Like if you're being given $600 for a 1 day of testing, how many people are going to say no to that? Right. And so the remuneration that you get has to be in line with the research effort that the effort it takes as a participant, and it can't be coercive. Otherwise it becomes coercive. So other things like going into the community, having focus, talking about what are barriers. Sometimes barriers are simply, I don't have a babysitter and I can't take off work during the week. So I want to participate, but do you have a weekend appointment? So being more flexible with that, maybe offering bus passes because people don't have a way to get there. But if you offer them that way, either bus passes or sometimes studies do Uber or taxis or whatever, so that the participants can or want to remove the barriers, right? So some people want to participate, but they don't like have babysitters for kids. So if you can have like a little daycare where they can, if it's a long time, they can drop the child off in daycare and then they can feel like they're, they don't have to worry as much. So can't take off from work, come on a weekend. There's so many ways that it can be a barrier when we're trying to recruit within our community and other communities, that we have to be more flexible. We have to advertise within the community and not on a board someplace, because we know about food deserts and we know about all these things, and not every place has a Starbucks. So hanging up a flyer at Starbucks is probably not going to be the best for, the particular population you're trying to recruit.
That's great that you bring up some of the barriers that need to be addressed for researchers to get these communities to participate more. One thing you had brought up a while ago was the terminology informed consent. Can you elaborate on that? What is that?
So you brought up informed consent. I didn't actually say informed consent. But informed consent means that you understand, so that the researcher has fully explained the course of the research, what you as a participant will be doing, has explained the study, what they hope to find out from the study, that they are not misleading people. Hopefully they're not doing a study where they're trying to mislead people, but that you really have an understanding of what's expected of you. And so that's informed consent. And no one should sign informed consent, and no researcher should take an informed consent unless they're sure that the person understands it. And therefore, when you go in, if the researcher doesn't ask you to tell them in your own words what you're going to be doing, then I don't know, I might not participate in that, because how do they know that you really understand? The only way that we know is that you're able to repeat to us whatever we've shared with you, and and if you don't understand, that we correct it and then give you another opportunity. So that's informed consent.
You brought up in your presentation really how there's different ways to find Alzheimer's, at least genetically, in different ethnicities. We're getting quite a few questions in the audience. If you could give about that, can you give a quick summary about a little bit more information about how APOE4 may not manifest in Black populations when they're looking for risk factors? Also, if there is an indicator of dementia that's more hereditary.
So it's funny. Okay, so APOE does. APOE4, so there's 1, 2, 3, 4. These are alleles on genes. I'm not going to get all into all of that, but APOE4 is the one gene that they have found that suggests a genetic link to developing Alzheimer's disease. If you have one, it raises your risk. If you have two, it's almost certain. However, in African American communities, what they found is that a lot of us have that, right? But we don't have a higher risk because of that. And so there must be some other things, which we know there are. Some of them are social determinants of health, but there are also some other biological things, genetic things, that they maybe thought were not as important. And that's because so many of the people that were in this big study across the country were white and they developed Alzheimer's disease. And one of the things that they all had in common was APOE4, having this APOE. And so that's why if more of us had participated in that kind of study, then they would have earlier on understood that it's not just that particular gene, although it's a big part of it. They're still not sure how it works within our community to say that it's likely that you're going to develop it, right? It's not like the BRCA gene. Does everybody know what the BRCA gene is? That's the gene in women that if you inherit it, you're going to develop. It's like almost definite that you're going to get breast cancer. It's that breast, and it was found by a Black doctor actually. And it happens in Black women really have it more often than not. But so the way that we find those things out is by us participating. But if we're not participating, then they're just going off the knowledge base that they have of the population that has come in. So you can have it genetically. APOE4 is supposed to raise your risk almost 100-fold, I think, to predict developing it. But it's so funny because I think it's in the Japanese that if they have both, I say 100-fold. I don't mean it that way. If you're Japanese, I think it's almost 7 times as likely that you're going to develop it if you have to, versus if you're white, it's like a couple of times more, it doubles your risk. And if you're Black, it doesn't do anything necessarily. So every ethnicity they're finding is not always the same. It's not a flat thing. So sometimes it's, they think it might be some of these vascular risk factors that we discussed a minute ago. The research continues to grow and it changes so frequently. So all I know is we need to participate.
That's a good point, that research grows, especially as the brain evolves, and that we need to participate more. We're getting a question from the audience of, Are there any studies going on now or on the horizon that you can recommend? And I'm going to add a second part to that. How can individuals, you mentioned, not in Starbucks for some communities, where can individuals find studies to get involved?
That's a good question. First of all, you got to decide what kind of study will you partake in. So there are studies that are non-invasive. You go in and you maybe do some testing, or they ask some questions, or it's something benign. And then there's studies where they want to take blood. That's another level. There's studies where they want you to donate your brain. So there are all these different levels. And depending upon where you are, Tanya, will depend upon the type of studies that are available. So any drug studies have to be registered with the National Institute of Health. You can always go online there and find studies and see what kind of studies are going on. There's almost 200 right now, drug studies going on for Alzheimer's disease. Believe it or not, there's always a bunch of studies. Other than that, university medical centers near you, if you live near a university medical center, they almost always, if you go to their Department of Neurology, or depending on where it is, they always, UCLA for one, there's so many studies going on. They have a whole research center just for Alzheimer's disease. So there's always those kinds of studies going on. I know what we're trying to do, and Courtney, where are you? Is she still here? I know what we're trying to do as an organization is allow for our researchers to post whether they have active research or not on their profiles. We don't have an avenue to put up a vehicle to put up like all the research, because I can't review everybody's study to say whether I trust to send people to. That's why it's better for me to teach you what to look for than to try to recommend a bunch of studies to you. Yeah. What was the other part of your question, Akeisha? Harley?
You answered it, like where to find these studies.
Yeah.
But someone is also asking the question, you kind of brought it up too, like we want to teach people what to look for.
Mm-hmm.
What are some good questions to ask when considering if someone should get involved in the study?
Yeah, I think you should ask them first, are you IRB approved? Why not start there? Are you IRB approved? What do you hope to gain from the research? How is the research going to impact my community? Is it going to benefit my community? If so, how? I think it's okay to ask those questions. I also think it's okay to use how you feel, your feedback. When you don't like a doctor, you don't go see the doctor, right? If you don't like the researcher, you're not going to show up to the research thing. So it doesn't even make sense to you. I'm just being honest, right? If you don't like the doctor, you're more likely to cancel appointments or not go. It's the same thing with any other commitment, right? Advocate for yourself. If you feel treated a certain way by a researcher, take that as part of the information in making your decision. Because if somebody's not treating me well, why should I volunteer my time, right? That'll teach people how to treat you. I think that that's important. If people seem short and like you're bothering them with your questions, then that's probably not a researcher that you should work with. Find out if they've done other studies similar. Is this their first time? What made them want to do this study? I think it's okay to want to get to know people. Why are you doing this? Is it just because there was funding available? Which, that doesn't mean it's bad, but it's helpful if people have a reason that's, that they're passionate about behind it, because they think they protect the research more. Those are all my personal.
Those are good ones. Someone in the audience is also asking, I think this is a great question to honestly ask a researcher, but how safe are the long-term efforts of studies that are being done?
Long-term effects, maybe?
Sure.
Okay. Is it efforts or effects, Marvin? I just want to answer the question right, because if I answer it wrong, you'll be like, she don't know what she's talking about. She got my question right. I think you're asking how safe are the long-term effects of studies. So I think people have this imagination that we do a study and then we have all the information. Unfortunately, that's not how it works. Science is a living, breathing thing. And every time we learn new information, it broadens our understanding, which allows us to be adaptive and make changes, right? And so they used to treat cancer only one kind of way, and then they realized, oh, it needs to be other ways. And then they realized, oh, this works on this type of cancer, or this works on that type of cancer. And then maybe 5 years later, they learned, oh, but when we treat people with this type of drug, it also may cause bone cancer. And they may develop that later. But that doesn't mean they take the drug away. What they do is they add the warning to it. So when you talk about long-term efficacy of drugs, which is what I think is the only thing that we could really be talking about right now, long-term efficacy, we don't know until it's further out, but usually we see immediate adverse effects right away in trials. Does that make sense? So the really major adverse effects we see right away in trials because people get sick, people die. And we see those right away. But keep in mind that if it's 1 million people that have taken this drug in the drug studies, and 5 of them died, they died while taking the drug. It doesn't mean the drug caused the death, but they still have to report it as an adverse event. If somebody got a headache taking that drug and they come in and say, oh, I got a headache after the last time I was here, they might not have eaten. They might have hit their head. I mean, there are a lot of different reasons. So we have to be careful when we want, science is only as exact as the knowledge we get from the information we have. And then we broaden that and we grow from it and we adapt and we make changes. Does that make sense? So long-term effects start to be seen probably 5 to 10 years down the road when you're taking a drug. But if you're taking a drug for Alzheimer's disease or one of these other things, you have to think about lifespan as a whole. So if I'm 65 and I was diagnosed with Alzheimer's disease and I want to be in an experimental thing because I've decided in my own life that I don't want to live to be 70 if I'm going to lose my memory, right? That's my personal decision. And I base my decision to be in that research that may be a little bit more risky off of the fact that maybe it'll kill me earlier, or maybe it'll hold my cognition longer. So some of the decisions that you make about these things are going to be based on your own personal belief system. And so I sit down with families all the time, and I always ask, like, people with cardiovascular risk factors that are uncontrolled. I always ask them, how old are you right now? 75? You want to live 10, 20 more years? What you want? And they're like, oh, I don't know. Maybe, I said, that's something you need to think about. I said, because if you want to live longer and you want to keep your brain as healthy as you can, you need to make these changes. But if you're saying I've had enough years and I'd rather eat all the fried food in the world rather than have another 10 years, I say go for it, but understand that you're going to be sick along the way. And so some of it is on us. It's our responsibility to make the decision based on our own belief system and our own what we prefer in our lives, our own preferences, for whether the risk, because you don't know at the beginning stages. Also keep in mind that if you do a study, there are 3 stages for clinical 3. Okay, I got my 3 fingers up. There are 3 stages. There's stage 1, which is the most risky. They don't know anything. They're just trying a new drug. And usually people that enroll in that are people that are pretty, they really are in need of, they're willing to be experimental. Stage 2 means that they've gotten cleanly through stage 1. Maybe some edits were made, maybe some adjustments were made, and it's still not ready for market, but it's been granted the next stage. And then stage 3 is, after this, we show the efficacy, how many people got better, we show their changes in whatever disease it is, and then the FDA, it goes for FDA approval. The problem is recruitment for some of the simple things, well, not simple things, but say recruitment for an illness like, oh God, somebody give me an illness that's not sickle cell anemia, okay? They've been trying to cure that for forever. But when you think about it, it usually only happens in Black communities. And then you have to get up enough people, recruit enough people for any treatments. And that recruitment can take years because we don't participate. And so when you see something like that, where it affects a small population, especially in a population that doesn't really participate in research, the reason why the drug takes forever to come to market is because of that. They still have to show the efficacy, and they have to have recruited enough people. When you take something like COVID, for instance, where it affects the whole world, you got everybody can volunteer. You know what I mean? Everybody's a candidate. So you can do the research in a much more condensed time, and you can even maybe do the research, the 3 stages, alongside each other. Did that answer the question?
Yes.
I'm talking about this stuff and I get so.
It did. Thank you.
Thank you.
You brought up, and you kind of brought it up again. So earlier you brought up Alzheimer's disease, and then you also brought up vascular dementia.
Mm-hmm.
Are studies being done in our community with regards to vascular dementia?
Yes. So we're always looking at every dementia. So a lot of people use that term dementia as though it means that's the disease you have, when dementia is actually an umbrella term for basically your brain not working right. And it has many causes that it's not working right. Sometimes it's a protein, sometimes it's plaque, sometimes it's these other, tangles and other things, proteins that are causing a problem. So there are many types of dementia. Vascular dementia is one of them. That can happen. Usually it happens because of those vascular risk factors over time built up. There's always studies looking at that. There's always studies looking at, frontal temporal dementia, Lewy body dementia, all of Parkinson's plus dementias. I could just keep going. There are a lot of dementias. So there's always studies looking for those. Especially studies need Black men.
Mm-hmm.
We do. We really need Black men.
Mm-hmm. Kind of in that vein, what are ways, or how can researchers encourage Black people to participate in studies? And that's part one of my question. Part two is, I guess it's sort of related. What are ways to really foster culturally sensitive research?
Those are two big things, right? I recently had a conversation with someone, and I said, if we think of everything as the undoing of all the bad stuff, we will always be overwhelmed by the idea of that. I believe rather than looking back, trying to fix things back that happened, I think we have to go from where we are and educate. I think talks like this, getting this information out there. I spend a lot of time in conference with my families that come in that I'm giving bad news to. I go out in the community and I speak. So that's one way. Obviously, I think of myself as a researcher, right? And so when I go out, I might be talking about Alzheimer's or dementias at large, but I always bring up the importance of research and the participation of research. When people see my name enough, when they see me enough, I'm approachable. I'm not some kind of weird staid person. I don't talk down. You know what I mean? It's like relational. And so I think we have to bring our therapists with us into some of these rooms with people and understand people's fears. I think we have to, as researchers, understand their fears and empathize with them at the very least. Being part of the community, I already understand. And so my feelings are wide open about that. And I'm open to hear from people and their fears and try to provide them with the best answers and the most honest answers that I can. And when I don't know, I tell them I don't know. So that honesty is important. Encouraging people to do all the things that I said, like knowing that you have power in the situation. It's not just the researcher. You have power as well. And that power includes walking away if you're not comfortable. I think it's beholden on all of us as a community, as you learn to teach other people. So when you hear somebody say, oh, they're going to be guinea pigging on me, you say, well, are they really? Tell me more about the study. What do you know about the study? Because oftentimes people just say that because it's so common for us to think that automatic. It's like an automatic bias. And so we have to begin as a culture to eliminate that bias. And we do that by being educated and then educating people when they say things like that, not being like, oh, no, you're wrong, but saying, tell me more about why you think they're being a guinea pig. Okay, is that what you really know? Can we look at what they're doing? Can we talk about it? I want to learn more. So being open and understanding and being curious and being, able to be told, if somebody tells you that they had a bad experience, I'm not going to argue with you. That was your experience. And so I think being more open and not so sensitive to criticism is going to be a large part of it. And again, making those connections in the community is huge. Can I answer your question?
Yes, absolutely. That's great how you kind of break it down, and it's twofold, right? It's both from participants and researchers. Can you talk a little bit about studies that are not invasive? Because not every study out there is about drugs. Can you talk a little bit about neuropsych studies that are non-invasive? And I'm going to add another part to this question. Where can people, for these drug studies, where can people find these resources?
Yes. Again, this is going to be, okay, for one, neuropsych studies, which is what we're all about. Neuropsych studies usually require people to come in and be tested with instruments. So they can be an instrument that's already been validated, meaning that we're already using it clinically, or they could be studies where somebody has decided, I think this would be a better tool for maybe the community that I'm testing, like multicultural. This one maybe has more multicultural sensitivity. And in order for us to get that validated, we have to have people that come in and volunteer and do research. And the only way to change the way people norm or think about our community and our brains, or Hispanic communities and their brains. When I say instruments, I mean assessment. So the assessment we often call an instrument. And so some of the studies are just to get people so we can kind of get a normative, basically, when I say normative, when we can get a sample of people of the same age, same education, kind of like get a sample and see how they perform on that test, and kind of get some data that tells us what is this test measuring? Is it measuring what we want it to measure? Does it have all the validity things that we can take it to market and it can be used in the clinic? So most neuropsych studies are aimed at clinical use of either the information or the assessment that we're trying to develop. Sometimes we're just looking at disease processes. So say vascular dementia, if you want to see if people as young as, they say, in their 50s start to show MCI early and what the first signs are of vascular dementia in that age is, we might do a study where we recruit people of that age range in our community, and we ask you to come in and we test you, and then we maybe ask you to come back a year later to test you, because it's always mild cognitive impairment. I'm using all these shortcuts, and Dr. Ray is getting on me. Mild cognitive impairment is the stage before anything converts to a dementia. So if we want to see if if you're starting to show symptoms of maybe a longer term illness, we might look at that age range and see what they have in common. And that might help us understand the earliest age that we should be looking at it. You know what I mean? And so there are all these ways, and all you're doing is coming in, being tested for a couple of hours, few hours. Sometimes we want to see, we want people to come in with a person that lives with them so they can give us their own opinion about how that person is doing functionally, meaning, are they able to wash their clothes, do their bathroom, do their grooming, do their dressing, manage their medications, drive? Sometimes we want a second opinion about that, collateral or an informant opinion. And that's because as people progress along in dementia, sometimes they will tell you that they're doing all that stuff, but they're really not. And so that helps us. It helps us get closer to the real symptoms of the stage that they're in. So there's so many ways. Sometimes it's by survey. So we're going to be doing a survey looking at COVID and people's experience with COVID who weren't hospitalized and feeling like they have cognitive problems. As an organization, we're going to be looking at that, especially in our community, which was highly impacted by COVID. And then later we want to set up centers where people can go in and get tested, and we can actually see, these are what they're reporting. These are the symptoms. Are we seeing the same thing on testing? And if we are, then we can really begin to encourage doctors, because the third stage of that is to kind of do a cognitive rehabilitation and cognitive remediation, and really get people treated in a way that we think can improve their cognition after they've had something like that, kind of similar to when people have a stroke. So there are all kinds of ways to get involved in it. Sometimes it's just filling out a questionnaire, looking at symptoms. I mean, it's from the most benign to the most invasive, right? Sometimes it's a joint study where we might be, as neuropsychologists, creating a battery of tests, meaning a group of tests that we want to give. And then we also want your blood, because we're going to be looking for proteins or whatever. Maybe we're looking at cortisol levels. I mean, there are so many combinations of ways that this can happen. The blood would be invasive, but the spit test for cortisol would not be. So there are all these ways. I know you're laughing at me, Dr. Harley. Can I keep going? I feel like I can't think of a million things here. Researcher in the house.
For sure.
I hope that answered your question. I probably
you did. And I don't want to take too much more of your time or our audience time, but I do want to open up if there's any other questions in the audience before we end for today. It sounds like no. I will ask one more question before we end, because I have one, and I think it'll be good for our audience to know. So a lot of times as a neuropsychologist, more on the clinical side, patients will ask me or do their own research and turn to Dr. Google or WebMD. So I want to make sure our audience will know where are better places to look for kind of more of these non-invasive results of non-invasive studies. Because you brought up things like exercise, diet, that we did talk about in our previous talks for Brain Awareness Week. Where can people find things like that and the research on things like that?
So that's a good question. I think I just must know some of these things just by always looking for things. Mm-hmm. But the Alzheimer's.org is a safe site for information for dementia type things. Okay, so you want to find a larger organization. If somebody's been diagnosed with vascular dementia, or you've had vascular problems and you're concerned with it, one of the big things that we say is exercise, being social, believe it or not, which is important, and diet are really important to kind of hold you where you are. And if you have questions about that, the Heart Association has a lovely page, but it's overwhelming because they have so much information on there. But they even have recipes if you're diabetic. I mean, like, it takes everything into consideration. They have thoughts for exercise. So those are some ways that you can find that stuff out. And they also, usually those things are backed up by research. If let me say this, and let me be clear about this. If you find some wonky research that you've never seen anywhere else online, and the only place you can, seriously, and the only information you can find on it is from that one source, that one person, I don't care how many different ways you see that person then said it, if it's that person, or if you see more than one source, like one or two, and they're affiliated with that person, that's not the body of science. So you should not be going with that. So people look for all these naturopathic ways, and trust me, there are. I just gave you some. There are naturopathic ways to increase your brain health or secure your brain health. But some of these things that people are saying they can do, people ask me about, I can't say the name of the drug because I don't want us to get sued, but there's a drug. I don't know if we could get sued, but there are drugs. And what I can tell you is the commercials, at the bottom of the commercial, it says for cognitively normal, or maybe it'll say mild impairment. And these are testimonies from people that didn't have any problems anyway. They just thought they had a memory problem. Okay, I said that. So be careful about what you're consuming. Go to those sites of places that have dedicated their whole organization to understanding that disease and then they will, like the Alzheimer's.org, they have a whole list FDA-approved drugs. If you want to know about the drug, it tells you about the drug. It tells you how the drug acts on your system. It tells you all of that. If you want to know about more studies, you can go to the National Institute of Health. The National Institute of Health, you will get lost on that site, let me tell you. But everything that has to do with health, whether it's asthma or whatever, you can go on there and put it in, and it'll take you to that site that specializes in funding research for that one thing. The National Institute of Aging, there's a National Institute for almost everything. Okay, so you can certainly start there and then find your way out from there. A lot of times they have brochures that kind of summarize the research and their recommendations. So those are some ways. Was that good enough?
Thank you, Dr. Montgomery. I think your talk today really, really talks about how research is twofold, and participants do have power in the research and to advocate for themselves, and for how we can advocate for our community. I don't want to take any more of your time. I think this was a great talk. Thank you so much for all of your wisdom on research. I'm going to pass it back to Dr. Ray.
Thank you.
Thank you guys so much. Thank you, Dr. Harley, for your interviewing skills. And thank you, Dr. Montgomery, for just a powerful presentation. I really do appreciate you answering all the questions from the audience. We had a lot tonight, and they were all great. They were all awesome. And I think that we're going to put some of the links that you've mentioned in the description below, so that people can link to some of those organizations that you mentioned as well. So thank you. Thank you guys, everyone, so much for coming this evening, for coming all week. If you have not been here for the other 3 presentations, we encourage you and invite you to please go to the playlist, watch the one from Dr. Shively Scott about cognitive health and physical health. Watch the one from Dr. Kier Mario about brain health and emotional health. Watch the one that I did about brain health and spirituality. And I want you to rewatch this one. There's a lot of information that Dr. Montgomery gave to us, and it's awesome information. So rewatch this and share it with other people who also could benefit from the valuable information that was given. So I want to thank all the presenters. I also want to thank all of our interviewers from this week, Dr. Kendra Anderson, Dr. Akeisha Harley, who gave the interview questions both today and on Wednesday. We also want to thank Doctors Will McBride and Jeremy Grant. Thank you so much for your participation this week. Again, subscribe to the channel so you don't miss other things that we do for our public, and also share this to others who would like to hear more valuable information. And brain health is for every age and any age. Don't just think that, and we talked a lot about dementia, but we also want to have our kids understand that it's important for them, and our teens and our young adults and our middle-aged adults and our older adults. At every stage, brain health is important. And I hope that you've learned something this week, and we hope to bring you more information in future presentations. If you'd like to know more about the Society for Black Neuropsychology, you can visit us at soblackneuro.org. That is our website. We will be putting more and more resources about different things for the public as the year progresses. We will continue to update that with valuable information. So go to our website. Once again, it's soblackneuro.org. And if you have any specific questions for us, maybe a question that you had for Dr. Montgomery that you didn't get a chance to answer, or for any of our other presenters, go ahead and drop us an email at soblackneuro@gmail.com. We also have a Facebook page, an Instagram, and a Twitter. So follow us on any and all social media, and we hope to see you again the next time we have another presentation. Thanks so much, and have a great night.